Breast milk has certain factors that formula doesn't have, and the main thing is the antibodies that it has from the mother, and that's for the purpose of giving the baby antibodies until the baby's mature enough to produce its own antibodies. The first few days we have the colostrum, which is a liquidy type of breast milk. It's got a lot of nutritional value, protein, and it's particularly suited for when you're first born. There are all kinds of studies. They do show that babies tend to do better, they have fewer infections, they tend to grow better, they thrive and do well, generally with breast milk, and they don't have as many of the complications that you get in a newborn nursery. Whether you're going to pump your breast to give breast milk or whether you're going to breastfeed directly, you really need someone to help you when you first start to get the type of pumping for the breast and produce milk, because the more you do the pumping, the more milk you make. And a lot of times when people are stressed out and they just don't do it right, they think they're not producing milk, but actually they just don't know how. And as far as the direct breastfeeding, the baby has to latch to the breast, and that usually takes somebody to coach you the first time. When the baby's really first born and very premature and can't suck at all, then you have to do what you call gavage feeding, where you actually put a tube through the nose and down the baby's stomach and feed the baby that way. And then once the baby grows a little bit more and can suck some, then by that time you usually have to bottle feed, because the baby did not learn how to breastfeed, so you would start bottle feeding later as the baby grows bigger. People forget that, when you get on a plane, they always tell you when they prepare you for takeoff that you put your mask on first. If indeed the cabin loses pressure, put your mask on first and then aid someone else. And that's important, that the mother's needs must be looked at first and foremost, because she's the key figure and must be taken care of. And there are times when she has challenges and other people need to come and help her with those challenges. It could be that she has to sleep at night because she has severe depression, anxiety, different emotional issues, and she's not able to stay up all night to breastfeed. And we would much rather see that in that situation, a baby being bottle fed and the mother being rested and being a better parent than being breastfed and she's cranky all the time because she's not sleeping.